Hi, and welcome to the final session of the New to DM track on the second day of the MDF 2020 conference. I'm Ted Salwin, the MDF Support Group Facilitator for Indiana, and also the facilitator for the Caregiving Support Group. I am deeply grateful to join you all today. I was the caregiver for my wife and son. She had adult onset DM1, and our Teddy had congenital. Later on, I will list the toolkits and other resources the Myotonic Dystrophy Foundation provides. And now, it is my pleasure to introduce to you Christina Irving, who will be talking with us about self-care and stress management for caregivers during the COVID pandemic. Christina is the Client Services Director at Family Caregiver Alliance, FCA. She oversees the staff of the Bay Area Caregiver Resource Center, who provide direct services to family caregivers, including assessment, counseling, education, and support. She has been with FCA for over 14 years, first as a family consultant and then as a clinical supervisor. She received a master's degree in social work from the San Jose State University and is a licensed clinical social worker. Christina, thank you very much for joining us today. It's all yours.
Great, thanks, Ted. And to get us started, I'm gonna go ahead and share my screen and share our PowerPoint that we're going to be talking about today. So hopefully you guys are seeing my slide well. I'm really happy to be here. I know it's the end of these 2 days, so I hope this has all been a really valuable experience for everybody and that this is kind of a nice way to round out your conference and to be able to talk about how do you support yourself as a caregiver. And I know that's not an easy thing to do when you don't have a lot of time. And so when we talk about self-care and stress management, it's through that lens of there's not a lot of free time that you have as a caregiver, and there's not a lot of resources that are always available. So how do you cope with that, and how do you get through that, given some of those challenges? So I'm really excited to be here with all of you today, and I hope you'll be able to share some of your own experiences and wisdom in the chat so that you can hear from each other as well. And we'll come back to Ted at the end to be able to talk about some of the resources specifically through the Myotonic Dystrophy Foundation. So we'll come back to him again at the end today. All right, so to get us started, this really is talking about self-care and stress management, but also with this lens of COVID and what we're dealing with right now. As if caregiving weren't hard enough, let's throw a pandemic on top of it and add all of those challenges that come along with it. So what we've been hearing from caregivers is that COVID has really exacerbated a lot of the issues and challenges that you might already have been experiencing. So juggling multiple roles that you might be working, but now you're trying to work from home while you caregive, and might be trying to help with remote learning and virtual classrooms while you're trying to caregive and potentially also work at the same time. We know it's stretching finances even more, and I think when we all spend a lot of time together in small spaces, we tend to get a little bit more cranky and irritable with each other, and so we're dealing with all of those challenges. And the lack of control and uncertainty that are so common with caregiving with chronic health conditions has really increased with COVID. So much that it feels like we can't control, we can't manage, we don't know where this is going to go and when things are going to end and how they're going to change. And that's just really increased and led to more stress for caregivers. So some of what we've been hearing is that people are experiencing more stress, not really a surprise. So about 63% of caregivers during COVID have said that their stress level is higher. People feeling more isolated than they might have before, and less family support. So even for caregivers who might not have had a lot of family or friends stepping in and helping out before, now with people trying to stay distant and not pass on any potential infection to anybody else. We see people not wanting to come together. So even families who might just have been able to stop by for a visit before are now not coming over as often. And that's leading caregivers to be more isolated and kind of managing this on your own. And that means stress gets higher. So we're going to talk about this in terms of these 4 kind of buckets that you might experience stress. And everyone's a little bit different. So think about for yourself where you tend to fall. What are your signs of stress? It might be more cognitive, that you're having trouble thinking or remembering things, or you're just not kind of as quick to come up with those answers or responses. Or maybe it's that you have those constant worries and anxious thoughts that are just running through your brain and it's hard to quiet them down. Or it might be more of that tension in your neck and shoulders or stomach aches. Maybe it's more behavioral and your eating habits or sleeping habits have changed. You might be using some coping mechanisms that are not so healthy, drinking more, smoking more, or other just nervous habits. Or maybe you're more emotional, a little bit more irritable, a little moody, a little less patient, and just generally feeling overwhelmed. So take a moment and think where you fall. And if you'd like to share that in the chat with each other, but really important to know what stress looks like for you. And we're going to come back to this later because this can tell us how we might manage our stress in terms of knowing what does it look like? How does it present for us? Today, as we're talking about managing stress and self-care, we're going to come at it from the model of resilience. We can't get rid of all the stresses in our life, but we want to figure out how do we cope with it? How do we manage it? And resilience is getting a lot more buzz, a lot more awareness lately, because I think people realize that this is the perspective that might be most helpful for us. So lots of definitions of resilience out there, but the one we're going to look at today says that resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. And my guess is that probably resonates for some of you as a caregiver, that this is a lot of what you're going through. And resilience doesn't mean that those things don't bother you, that they're not stressful, that they're not impactful, but it's how do we adapt to it? How do we recover from it? So a lot of times you'll hear resilience defined as how do you bounce back? But it's really more about how do we bounce forward? How do we move forward from these things that are really stressful? And so the model that we're going to talk about today follows these kind of 5 components: about embracing healthy thoughts, finding purpose, building connections, seeking help, and fostering wellness. That these are some of the ways that we can build up resilience and support ourselves in the face of stress and adversity, trauma, or tragedy. And the first one we're going to talk about is our thoughts. How we think about things has a huge impact on how we feel about them and how we manage it. And we actually have the most control over how we think about things. Unfortunately, it can be the hardest to do sometimes. So one caregiver who took care of her husband with cancer said, "You can't control the situation, but you need to think clearly to understand how to navigate it." There's a lot we can't control, but our thoughts are going to impact how well we get through it. And we tend to listen to ourselves. We may not always be aware of our thoughts, but they do make a difference. So thinking about what are some of the unhelpful thought patterns that we tend to have that make it harder for us to get through the day. One of them might be overgeneralizing. Everything is horrible. I can't do anything right. Nothing's going well. The thinking I should be able to be more patient. I should be able to get everything done today. I should know how to take care of this person. Trying to predict everything that might happen. What happens if I get sick? There's not going to be anybody there. Nothing's going to work out correctly. And that labeling ourselves, that if we do have those moments where we get cranky or impatient, or we don't do something the way we think we should have, that we feel like, well, I'm just a horrible caregiver. I'm a horrible person. I can't do it right. And instead we want to look at how do we keep things in perspective? doesn't mean we don't acknowledge the things that are hard or difficult, but can we find what went well? Can we find the positive? We do a lot of trainings, and for a while we were doing some trainings with the VA for caregivers of veterans, and we were traveling all over the place, and I was in some hotel, I don't even remember where, and those little notepads that are next to the telephone, this one, rather than it just being a blank notepad, it said accomplishment list. Much better than a to-do list, don't you think? And I was like, that's what we often need to think about to keep things in perspective, is not just what's on that to-do list that I didn't get done, but what did I accomplish today? So think for yourself, what's something that went well today that you did? What's something you accomplished? I mean, I can give you all one that you're here, that given everything you have to do, you showed up to this conference, to these events today, and you made that happen as a resource for you. But what's something else that you accomplished well today? And that positive slant on our thinking and on the day helps affect our mood and how we get through it. For I shoulds, realizing that there's more than one way to do things, and we're not always going to get it right. It's not always going to be perfect. And while we do want to plan ahead, we do want to make sure that we're being proactive. We can't predict the future. So we want to think about what can we control, what can we do in terms of planning for what might come next. But we don't want to dwell in every potential outcome, because we're not going to be able to solve that. And realizing that imperfections don't define who you are. They are one moment in time, they are one thing that happened, but it does not define all of you as a person. So when you have these thoughts, and the first step is really paying attention to what your thoughts are, being able to analyze them and figure out, is that true? Is that thought of, I didn't get anything done today, is that really right? Or are there things that you got done? Are there things that you accomplished? So paying attention to your thoughts and being aware of them and embracing the healthy thoughts is going to help us move forward. Our thoughts really feed into and impact our emotions and how we feel. And with some of these, they really will impact one of the more common feelings of caregiving, which is guilt. Definitely those I shoulds. I should stay patient, I should stay calm, I should be able to get everything done, I should visit more, I should make sure that they have everything they need. And it's this idea of being perfect. And perfect is a setup for failure, because none of us are there. None of us are ever going to be there. And so it's, how do we do the best we can with what we're given? So changing our thoughts, changing how we think about things is going to help improve our mood. And it's going to help us understand, is this something that I really should feel guilty about? If I'm doing something for myself, if I'm paying attention to my needs, is that actually selfish? Or is that me improving my capacity to provide care by not burning myself out? And so one way to help us do this is to differentiate between guilt and regret. Guilt is, I've done something to harm or hurt or offend another person. And then maybe I need to make amends. I need to say, I'm sorry, I need to do something. But regret is the sorrow we feel about circumstances outside our control. I regret that this person has this diagnosis. I regret that I can't do it all myself and sometimes I need help. And that can be a hard thing to deal with, but it doesn't mean it's wrong. And it doesn't mean we're doing something to hurt the other person. So changing how we think about guilt may help us feel a little bit better and cope with it. So again, how we think about things is going to make a difference with how we cope and how resilient we are with these stresses and challenges in life. One of the other kind of feelings that we want to be able to address and understand how it impacts us, that's important in building resilience, is isolation. Caregivers experience really high rates of isolation, and again, we're seeing this increase during COVID. Sometimes they come from feelings of abandonment. You know, is anyone else stepping up? Is anyone going to walk this with me and be there for me? We may not know what are the resources that are available. Sometimes there may be family around, but they may not really be on the same page as you. And what I hear from a lot of caregivers is, the only thing I hear from family are suggestions of how I should do things, not necessarily them stepping in to actually help me. And right now, especially those loss of social supports, it's so much harder to see other people, to be around other people. And that can make this a more isolating experience. So think whether this kind of resonates for you and how you've been feeling. Do you feel like you've been more isolated? What are the things that you've lost? Because we want to talk about building connections and how do we counter some of these feelings of isolation. The other emotional experience that we need to be able to name and address is grief and loss. So I'm wondering whether this kind of resonates for people, the idea that you are grieving. So this one grief worker said, when you have any kind of change, you often have loss. And when you have loss, you have grief. So what are some of the losses you've experienced? It might be the loss of a career if you've had to stay home to provide care. It might be that loss of the relationship as it was, of what you planned for the future. So there's a couple ways that we can look at grief and loss. And one is this idea of anticipatory grief, that we're anticipating what's coming next. And this might mean anticipating the death of someone, but it also just might mean anticipating a decline due to their diagnosis. And we're thinking about what's coming and grieving that, even if it hasn't happened yet. And the other one is this concept called ambiguous loss. The idea that someone's there, but not there. They're sitting right next to you, they're here with you, but it's not the same as it was before. You might have the same relationship. This is a spouse or a partner or a parent or a child or a sibling. There's still that. But you're also now their caregiver, and so it's different. And where we want to go from with ambiguous loss is changing our thinking from either or. Either I've lost them or they're here. It's one or the other. To this both and. I have both lost some of what this was before, some of our relationship, some of the person they were, some of maybe who I am, because this is not what I had planned for my life right now. I've lost some of that. And at the same time, what's remained? What's still there? Are there certain things we still enjoy doing together? Are there certain things about who I am and what's important to me that are still true? And changing our thinking to this both and rather than an either or can help us cope better. Doesn't mean that we don't acknowledge the losses, that we don't still grieve them. But at the same time, we're able to think about what's positive. What have I gained? What's the reality of our situation? And that can help frame our experiences in a way that helps us adapt and adjust to it better. So David Kessler is somebody who worked a lot with Elizabeth Kubler-Ross around the stages of grief. And these stages are not linear. They go all over the place. We're going from anger to acceptance to sadness to bargaining. We're doing it all at the same time. But where we want to get and where our goal, and it's an ongoing goal, is to acceptance. And in a recent article during COVID, he wrote, acceptance, as you might imagine, is where the power lies. We find control in acceptance. I can wash my hands. I can keep a safe distance. I can learn how to work virtually. We don't ignore the losses. We don't ignore the grief or the anger or the sadness. But when we try and move ourselves to acceptance, it lets us find that power. What can I control? What can I do? That's what helps build up our resilience and our ability to cope with it, is finding those things that are within our power and within our control. And it lets us figure out, how do I move forward with what our reality is right now? Now, the good, the bad, and the ugly of the reality, but what is that reality? And so part of that, one of the other components of resilience, is finding purpose. So has caregiving given you a sense of purpose or meaning? What have you found? What are some of the positive aspects of caregiving? So take a moment and share that with each other in the chat. What have you gained from this role of caregiving for someone with this condition? It might be skills, and these might be skills that you never wanted to learn, but maybe you've learned how to do it. managing someone's medication, helping them when they're less mobile, knowing how to communicate with doctors and advocate, all things that you probably never wished you had to do, but are those skills that you have learned, something that you can be proud of in yourself. That relationship you have with the person you're caring for, being able to say, I'm taking care of and I'm supporting my family member, those are all things that can give us meaning. And this is that both and thinking. We still grieve what's gone, but we find that purpose and meaning in what our reality is right now. And that can help us adjust and bounce forward from these stresses and challenges. There is more and more research that shows that having a sense of purpose might buffer some of those emotional stresses of caregiving. So that when you feel this sense of purpose, when you can acknowledge whether there's any positive effects, that some of those stressful challenges may not bring you down as far. Doesn't mean that they won't still be hard, but you may not experience the same level of distress or depression or anxiety that somebody who's not able to find that purpose and the meaning would. So think about that and share that. Any of the positive aspects of caregiving that you've experienced. And then building those connections. So again, thinking about isolation, thinking about grief, we need to have community. So coming to conferences like this is so great that you're here to be able to talk with other caregivers, share those experiences with each other, but to be able to find that community and to share that care. So asking for help and support, and asking for it for the person that you're caring for, but also asking it for yourself. It may be that what's going to be most helpful for you is having somebody who can just check in and chat with you every so often. But have those requests ready. It is hard to ask for help. You know, we tend to feel like, I need to be able to do it all. I need to be able to take care of this person. They're my family. That's my job. I should be able to do it. And a lot of times the people in our life may not know how they can help. If they haven't walked in your shoes, if they haven't provided care in some sort of way, they might not really understand the reality of what you're dealing with. So having those specific requests ready, what can they do for you? Can they go by the grocery store and pick something up so that saves you that trip? Can they come over and visit to give you a little bit of downtime? What are the things that they could do for you or for the person you're caring for that will be supportive? And we do have to be realistic. Not everyone can do everything. And asking for help will help you learn who really is going to step in and help and who maybe is not going to be there for you in the way that you would like them to. There are some great tools online that can help you provide updates to family and friends, that can help you create shared calendars so that you can post what are things that people could do for you. Lots of helping hands, Caring Bridge, Cozy, all ways that you can let people know this is what I'm going through. And this is where I could use help. These are things that you could do for me that I would appreciate. So think about, what are those things that people could do for you? What are things that would be helpful? And one of the next components of resilience is, how do we be proactive? How do we move forward? Again, what can we control? What can we do that might help ease some of that anxiety about what's coming or what's available or what do I do next? So seeking out resources, and we'll talk about kind of where you can start, but seeking out resources early is really important. Thinking about, what sort of legal documents do we need and should we have? During COVID, so much of what I've heard from caregivers is, what happens if I get sick? What do we do? And the more you can put things in place, the more you can have backups and have other people involved, the better. And that might ease some of your anxiety. So think about, do you have advanced healthcare directives? Do you have power of attorney? Do you have a personal health record so that if either one of you goes to the hospital, you have all that information about their medications, about allergies, about past medical histories, that you have it available and you have it at your fingertips so that you can share as needed. and ask about what telehealth options exist. You know, talk to the doctor. If there's a change in symptoms, if there's a fall, if there's any other, condition changes, should we go to the ER? Should we do a telehealth visit by video and talk to you that way? What would make the most sense? So that you know ahead of time what your options are and what your resources are. So often I hear from caregivers, well, we're doing okay, we're managing. If things change, we'll start reaching out for more help. We'll start looking at those resources. You want to know what's available before you need it. Because in those moments of crisis, it's so much harder to try and navigate through our, frankly, very kind of dysfunctional and disjointed system of care. We don't have a system that is super supportive of caregivers and is really easy to navigate. So knowing ahead of time what's available is going to make it a little bit easier for you, because you'll know what you're eligible for, where are their wait lists, what are the resources, before you're in that moment of feeling completely overwhelmed. So what are the things that caregivers need information on? One of my colleagues used to call it actually the IRS of caregiving, that every caregiver needs information, respite, and support. And that's true. Those are the things that need. So when we're talking about information, you need information about the diagnosis. So coming to conferences like this, learning as much as you can is really helpful in moving forward and figuring out, what do I do next? Learning about the resources, about any financial assistance, what your insurance covers, all things that help you plan and be proactive. All help you adjust and bounce forward from those stresses. So where do you find that information and referral? If you're in California, so I'm going to put this out there because that's where I'm from. Family Caregiver Alliance is one of the 11 caregiver resource centers in the state. So those are available as resources to help you figure out what are the services and supports, where do I start? Elder Care Locator is a national program for connections to services for older adults and adults with disabilities, and they can usually do a pretty good job of directing people to services for children as well. But they really are an information referral point. They're going to point you back to your community and where the starting points are there. And then obviously you're here, so you know about the Myotonic Dystrophy Foundation. Another great resource, both on the web, the warm line. I'm going to leave Ted to talk more about this at the end, but talking about some of the supports and resources there. But places that you can start. You don't have to know everything that's out there, but you just have to say, this is what I want to know more about, and this is what I want to know if there are resources that would help me. Respite just means to get a break. It's something we all need, not always easy to find. It might be asking family members or friends. It might be hiring in-home help, which unfortunately often has a fee with it. Might be through a home care agency, through finding somebody privately through a registry, or through word of mouth from a church or a senior center or a friend. But there's also a program through the Arch Respite Network called the Arch Respite Locator. And it can direct you to what are some of the local respite resources. Varies state by state what it looks like and what's available. But there are these what are called lifespan respite programs. So respite that can be provided across the lifespan if you're caring for a child to an older adult. Again, varies a lot state by state, but really good to reach out through the Arch Respite Locator to find out what are those respite resources that might help you get more care in the home, or at least understand what those local services would look like. One of the most common questions we get from people calling us is, can I get paid to be a caregiver? Knowing that financial stresses are huge for families. If this is something you're doing, and again, you may have had to leave work or cut hours, can you get some sort of compensation to help provide this care that you're doing? And the answer is maybe, sometimes, depends on where you live. There are Medicaid self-directed services that can help pay for in-home care. Obviously, the person needs to be on Medicaid, so that has those income and asset limits. In some states, certain family members may be allowed to be paid. So some states will say family members can be paid, but not a spouse or a parent. In other states, that can be true, that a spouse or parent could get paid. So it varies so much state by state. How many hours they'll pay for is determined by the assessment that they do. So you can go to FCA's website, to caregiver.org, and click on our little family care navigator, which is the map of the US, and you click on your state, and it's going to bring you up a list of some types of resources or information. That bottom one is called caregiver compensation, and when you click on that, it's going to tell you what are the programs to provide caregiver compensation in your state, what's the eligibility, will they allow family members to get paid, and it'll help give you at least that direction of where to start. But again, really good things to look at. I know this is on one of the new to myotonic dystrophy tracks. So if you are kind of newer to caregiving and you think, well, it's not too bad, you know, we're doing okay right now, still good, be proactive, look up this information now. It's going to give you more of a sense of control, and it's going to help you down the road. And we'll come back to some of the questions. I see one about what was the caregiver resource again? And I'm not sure which caregiver resource that you're looking at. So I'm going to go back just to one more slide before this to say the Arch Respite, if that's the one you're looking for about, okay, hiring, maybe finding out about some resources to bring in respite. So Arch Respite Locator. And I will share these slides with the foundation afterwards. So if they're able to post them, they can, and you'll get the links for everything. Because I know it can be a lot to keep track of. Okay, so Arch Respite, great one. Find out about the caregiver compensations depending on where you live. And then the last component that we want to talk about in terms of building resilience is fostering wellness. And this kind of aligns with what people tend to think of as self-care. Some people hear self-care and they think, I don't have time for that. I can't get out of the house for an hour. I can't go on vacation. I can't go get a massage. Totally understandable. Those are not all the things that self-care are. If you can do those things, do them. That's fantastic. I really encourage you to. But it's also about finding those things that just help us feel well, both emotionally and physically. Going to your doctor. That's a really important thing that unfortunately we know a lot of caregivers will tend to put off. So think about, when was the last time you saw or at least talked to your doctor? When was the last time you got your checkup? Really important to do. It might mean seeing a therapist, but it's also the little activities, the little things that we can do throughout the day that help promote wellness, that help reduce our stress. So take a moment, share with each other, what are some of the things that you do? What do you do to manage your stress? What are the things that you do that help you feel better during the day? I was actually on a presentation this morning and somebody said, you know, YouTube videos that make me laugh. That was the thing for her that really made it through her day, was just finding those silly YouTube videos that were just going to make her laugh and smile for a moment. But it's finding things that are little, that you can incorporate throughout your day on a regular basis. There's an old saying that you cannot pour from an empty glass. So if you think of yourself as a glass, you're pouring out that water constantly to the person that you're caring for, giving of your energy, of your time, of your strength. So finding things that help replenish and refill that glass. And if you wait until it's drained, if you wait until it's at the bottom, it's that much harder to refill. But even drop by drop, little by little, if you do it on a regular basis, it does make a difference, and it's more realistic. When you don't have a lot of time, you may not be able to say, I'm going to go for, 45-minute walk around the neighborhood, but can I go for a walk around my house? Find some sort of little exercise that I can do outside. Breathing exercises, relaxation exercises, all things that you can do in short little increments. So early on, when we talked about what are your signs of stress and how you might experience them, this ties back to that. If you're somebody who experiences stress very cognitively, it's all in your head, it's the stresses, the worries, the anxieties that don't ever quiet down, you might do well with reading, journaling, maybe crossword puzzles if those don't stress you out more, but something that engages your brain is going to help you quiet down some of those anxious thoughts and worries. If you carry your stress very physically, it's the tension in the shoulders, the stomach aches, then exercise, even just stretching, is going to make a difference because it's going to loosen up. It's going to let go of that stress in that physical way. If you're more of an emotional person, talking to a therapist, talking with friends, journaling, those might be great ways to release some of that stress. If it's behavioral, then really getting those regular practices in, some sort of habit of kind of exercise and breathing and journaling and all those things, whatever works for you, but just making a regular pattern and habit of it is going to make a difference. So you want to tie these things together because it's going to be most helpful for you. These need to be things that you enjoy and want to do. Otherwise, you're not going to do them. One thing that I've actually seen in about 3 or 4 articles this last week was something that they called awe walks. As hard as that is to say, but basically experiencing the awe of nature. And they looked at it in terms of going on these walks in nature, which is a wonderful way to do it when you have the time. But if you don't have a lot of time, if you can't get out on a good nature walk, can you experience that awe of nature in your backyard? Walking down the street? Do you see a flower or a plant? And rather than just looking at it and keep going, can you stop just for a moment and recognize kind of that beauty of it? Whatever you find that brings you that sense of awe, because it takes us out of ourselves for a moment. Those things that foster wellness are those things that slow us down, that relieve some of our stress. And again, they don't have to be big things, but it's things that we do regularly, that we incorporate into our life on a regular basis. And so I'm going to show you one, if I can get it to play. There we go. That when you think about, I don't have a lot of time, this is something called triangle breathing, that as it expands out, you're going to breathe in. And then you're going to exhale as it comes back down. And we know that deep breathing is one of the simplest and a very effective way to manage our stress, to build up that wellness, because it slows us down. It slows our heart rate down, helps us lower our blood pressure if we do it regularly. And it's something you can do anywhere. So if you can find moments throughout the day where you just stop and you take those breaths and you breathe in and then you breathe out, it makes a difference. And that was 1 minute. And in 1 minute, can you feel yourself calm and center and quiet? So I hope some of these were tools that you can use to help you think about, given how stressful caregiving is, how difficult it is, what are the things that are going to help you cope, help you recover, help you build up your resilience, your capacity to do this amazing thing that you're doing of caregiving. Even when it feels hard, even when it doesn't feel like you know what you're doing, being able to recognize how much value you have and be able to take those moments just to think about, what do I need to get through this? And with that, I'm going to turn this over to Ted to share a little bit more about what his role is with MDF.
Okay, before I start that, Christina, thank you so much. That was impressive, and I used a lot of those things in caregiving that I didn't even know. And there were a lot of them were also mistakes I made over the years.
That's how we learn.
One thing that I just want to touch on, and then I'll go on everything, is caregivers, you are impressive. Every day, whether consciously or unconsciously, you choose to do the most difficult jobs we can think of. And my hat's off to you. And please take care of yourself. Visit a doctor. All right. I am the support group facilitator for co-facilitator for the Indianapolis Support Group. I was a caregiver family, or the family caregiver. Can you flip the slide? We have 23 active support groups here in North America. We are all volunteers. We would love to have you join us. I'm in Indianapolis. If you go to myotonicdystrophy.org, you will find the map that you see there, and highlighted, there's a support group. Now, if there's an area that you don't see one, consider joining us. It takes only care. And a lot of times, if you run a support group, you don't need any real super special training, but you get back twice as much as you give into it. Go to slide. This is some of the best information that the Myotonic Dystrophy Foundation has created. Everything has been verified by doctors, researchers, all of that. And the toolkits are really, really, really helpful. We have the anesthesia guidelines, clinical care recommendations for adults with myotonic dystrophy type 1, clinical care recommendations for children with myotonic dystrophy type 1, clinical care recommendations for adults with myotonic dystrophy type 2. We also have a small My Clinic visit planner that is available, and it can help you organize your next visit to your caregiver, whether it be, or to your doctor, whether it be your family doctor, your neurologist, your cardiologist, a GI doctor, your pulmonologist. And yes, with DM1, you will get to know every one of these. The next one is, yes, thank you, the clinical care recommendations for cardiologists treating adults with type 1. That one is reasonably new and very good. And, you know, I actually know one of the doctors that helped write that, and he was an amazing doctor and a great care for my Kim and my Teddy. We have the clinical care recommendations for pulmonologists treating adults with myotonic dystrophy type 1. We have respiratory care recommendations for myotonic dystrophy patients during the COVID-19 pandemic. That one is new and very poignant right now. We have other ones, occupational therapy suggestions for the management of myotonic dystrophy patient. Those are very important. A lot of times, I know, like with an occupational therapist for Teddy, I didn't have, this is what he can do, this is what, and they didn't know myotonic dystrophy. So these are very important. Nutrition guide for people living with myotonic dystrophy, that's important. We have the employment access toolkit, health insurance considerations for people living with myotonic dystrophy, applying for Social Security benefits. That is important. I was just in another breakout session where, with congenital children that may or may not get, had trouble getting approved for it. Going to school with myotonic dystrophy, a guide to understanding special education and IDEA. That one was very good. I even was able to help in the creation of that. It is wonderful information. It will help you deal with your child in the school system, and it will give you something to take back to the school to say, here, And the guide for caregivers, adulted or Guide for Caregivers of Adults Affected with Juvenile Onset Myotonic Dystrophy. That one is also a very good one. Next slide, please. The additional resources, the Digital Academy, myotonicdystrophy.org, everything that we have spoken about. We have videos, we have recommendations. Myotonic Dystrophy Foundation also has a warm line. And believe me, it won't, it's not a hotline. They will get back to you, but you'll find a caring person who is able to help. And find a doctor map. They will, if you are uncertain in your area about what doctor would be good for myotonic dystrophy, look it up. The families, the caregivers, the people with myotonic dystrophy recommended our doctors to it. So they do know, they found a doctor that understands myotonic dystrophy, which is incredible. It was always very difficult to find one that understood enough to care for my wife, Kim, and my son, Teddy. And I am having a Zoom meeting, a caregiver support group through Zoom on October 17th at 2 p.m. I would love to have everybody join me. And you'll see the link right down there, and it is available through Myotonic. And that's all I have right now.
Great. Thank you so much, Ted. And we have had some questions come in, so I'm going to read them out and I'll respond to some. And Ted, if you want to jump in from your experience as well and respond to these, I think it would be great. So one of them is, how can we be proactive when we don't know which direction the decline is going to go? If we're already experiencing falls and weakness and cognitive decline. And I think this is such an important question, and unfortunately such a common question, is we don't know. We don't know where things are going to go. And I think that's, the first part is recognizing that you're not going to know. There is not one direction for any of these conditions. There's not one way that they're all going to look. It can be great to talk to other caregivers, hear from their experiences, but just realize that doesn't mean that your situation is going to look exactly the same, but it can still be really helpful to hear from them. And then it's realizing that you're not going to know exactly where things are going to go. And so because of that, you actually do just want to start finding out about what are some of the services that are available. What do they look like in the community, or at least where do I start? So even making those first calls to say, what is it that you do? Would you be a resource for me if I start needing more help? When caregivers call us, we say, we may not have all the answers, but our role is to help you navigate and direct you to where you go. So you don't have to know what all the resources are, but you just have to say, this is what I want to know more about, or this is what I'm worried about. And our job is to help give you that guidance. So any of those resources that you first call, all you have to do is say, this is what I kind of want to know more about, what's available. But talking to other caregivers is, I think, such a huge help to find out what was helpful for them and what worked for them. Ted, I don't know if you'd add anything to that.
Well, with myotonic dystrophy, it will come at you from left field. One of my friends in the community, God bless her, she once likened it to a thief. It comes by and it steals a little something, and it comes back. And the one thing that I always used is, well, what do I have left? I always enjoyed the ability to enjoy what my wife had left, what my son had left. You by talking to other caregivers, you can really find out, well, myotonic dystrophy did this, and you'll find somebody whose experiences are different, and you can compare. And the only thing I can say, prepare yourself for the resources, like Christina said, but don't get lost in what is being lost and not be able to enjoy what you do have.
Mm.
Every day needs to be unto itself.
That's such
I
a
hope
great
that helps.
phrase. That's, yeah, such a great phrase. Don't get lost in what's being lost. That's very wise. Right.
Use it anytime you want. It's
All right.
yours.
Okay, a couple other questions that came in. How do people decide when to leave work and to become a full-time caregiver? Such a hard decision, and it really varies person to person. I will say we generally will caution people if they're thinking about leaving work to really explore what their options are. Because one of the challenges when you leave work is you might leave your health insurance behind, what you're paying into Social Security, meaning what you're going to get from Social Security when it comes to your retirement. So you need to think about those financial considerations and what's realistic for you. So even when some caregivers say, well, what we're paying for out of pocket is what I'm making, so shouldn't I just then stay home? But those longer term potential financial resources are the other piece that you're leaving. So you don't want to discount those. You want to explore what your options are. Talk to your HR person or your union if you have one. What are my options for family and medical leave? So the 12 weeks unpaid nationally of the family medical leave, don't have to take it all at once, but you can take them as you need them. Does your state have paid family leave? Not a lot of states do, but some might for short periods of time. Would that be helpful? Explore what those resources are for potential Medicaid eligibility that might pay for in-home care, looking at respite and what does that look like. So it's a very unique decision to each person based on what family resources you have, what financial resources you have, and what are the community resources that are available. So unfortunately, it's not giving you a real good concrete answer, but I think those are the things to look at that might help give you a little bit of guidance.
I will completely defer to you on that question. I as a caregiver, I never had the means to where I could just, stop work and be a full-time caregiver. I wish I could have. I really wish I could have, but I was very, very, very fortunate that I did have a very understanding employer, and if I needed for them, I had it. That was never a problem.
That's great. Okay, and then see, one other question that was, what can I address with the DM patient's doctor about injurious behavior such as increased alcohol consumption? Oh, those are hard. And I would say, if there's things that you're noticing with the doctor that you feel like are unsafe behaviors or behaviors that just might be making symptoms worse than they need to be, you want to bring those up with the doctor. Some doctors are better than others about how to manage those and how to handle those. It might be that other support groups would be helpful, that talking with a social worker would be helpful. And it really depends on the person. A doctor may be in a great position, sometimes way more than the family is, to be able to tell this patient, this is what the negative effects are with these behaviors like alcohol. This is how it's going to interact with your medication. This is how it might be making your symptoms worse. And they may listen to the doctor more than they'll listen to you. But think about if there's somebody else in this person's life that they might listen to as well. How do you bring that in together? And what's the support that's needed? Ted, anything else you would add to that?
I think you did a fantastic job with it. I think you did. Anytime dealing with that particular situation is difficult.
Mm-hmm.
And, I mean, it's just a difficult thing to deal with.
Yeah. All right, Ted, I'm going to give this question to you first. How do you tell the rest of the family about the DM diagnosis?
Oh, that is difficult. That is difficult. A lot of I've noticed, especially like in my support group, and even more so with like the rest of the community. Telling the family, actually, honestly, is not that hard. the the difficult part is them processing it. I do have some families that have not told their family members that they have it. It's not something that I recommend. You sit them down and you tell them, when you have myotonic dystrophy as a person affected with it, one of your parents has it. If you have a sibling that might have it, there are concrete things that they need to be aware of, because the anesthesia problems. Even if they decide, we had one person in our support group that decided not to get tested. His mother had it. He had not been tested, and he had children. And I says, the first thing you've got to do is make every medical provider in your family aware that this is a possibility. It could exist. He eventually he got tested. He did not have it, which was really, really wonderful thing for us. But I personally, I believe, unless there's a concrete, you can't tell that family because they're violent, or also telling a family member about diagnosis. You'll find, if you're talking to older relatives, they've known something for a while. They've had Uncle Bob, who never got diagnosed, but he couldn't walk by the time he was 40, and he was gone by the time he was 45. You'll find you have a family history of it you were not aware of. I know my mom, my wife's family, until Teddy was diagnosed, didn't have the diagnosis. Therefore, my mother-in-law was misdiagnosed. My wife was not diagnosed. And we couldn't follow the tree back to her mom's parents. We had no idea which one. They were gone by then. But, I always recommend, as whatever method you can, please do tell them about the diagnosis.
Yeah, I think I would echo that. As potential opportunity for you to get support as well. I saw something in the chat about, denial from extended family members, and absolutely, you may experience that. You can tell people, and you might think about, a format for being able to share that information, give people a resource where they can read more. And some people are going to step up, and unfortunately, some people are going to step back. And there's not a whole lot you can do about it, but you want to give people that opportunity to step forward and be that support for you as well as for the person with DM. So I'd echo, Ted's response of try and tell people where you can. I will respond to one other comment, and I know I think we're kind of near the end, or if just over, so we'll wrap up. But I see one comment about the challenge of not knowing what our changes may be from MD versus kind of COVID isolation. And great question, and not necessarily an easy answer. But thinking about some of that isolation, how do we kind of build that community, maintain those connections as best as we can? And if it doesn't seem like you're noticing any improvement, then it might be that this is a progression. But those things that we would do during COVID to remain active, remain engaged, kind of keep up that stimulation are all things that are useful long-term for kind of staving off any cognitive decline anyway. So it doesn't hurt to do them now. And so I might worry less about what's causing it and more of, hey, this is a symptom, let's try and address it the best way we can, given what resources we have. Right.
Well, this is going to pretty much end it. I want to end with this. We do have my favorites on Facebook. We do have Caregivers. We do have Caregivers pages on Facebook. And every weekend, every Friday, I say Happy Friday, DM Warriors. Well, today I'd like to sign off with Happy Saturday, DM Warriors. It was great. Thank you, Christina.
Thank you. And thank you all for joining and sharing with each other as well.